Welcome, everyone. This is Dan Hoos, the Communications Director for Sullivan County Government, sitting here once again with our Public Health Director Nancy McGraw to give us a very timely update on what's going on with COVID-19 here in Sullivan County, what she's been hearing and seeing, so that we can be better prepared, especially with the holidays approaching. Nancy, thanks for giving us some time today.
Thank you for having me. It's been a while since I've provided a video update. And I wanted to take this opportunity to let people know what's happening in the county and what we're seeing. And there's been a lot of information on the news that people may have questions about in terms of variants and the COVID-19 virus. So just like many other counties, we have begun to experience an increase in the number of cases, people testing positive every day. That's been going on for the last week or so. And we saw a pretty big jump recently in the last few days, just right before Thanksgiving, and especially now after Thanksgiving, we're averaging about 40 to 50 new cases every day. So those are people testing positive, going to get tested because they're experiencing symptoms or they know that they may have been exposed to somebody with COVID-19. So the cases are climbing. We expect that to continue as the weather gets colder. People go indoors. We heard some of this last year. We expected this to be over by now, but unfortunately we still have a ways to go to get more and more people vaccinated before we can really get through the other end of that. So we really want to stress that, it is safe if you're fully vaccinated, and especially if you have a booster, please do that. If you haven't gotten a booster, it's recommended now for anybody 18 and older. There's plenty of opportunities to get a vaccine at your local pharmacies. We have a list on our website. You can call us. We are continuing to do vaccine clinics every week. We're doing not only booster clinics of Moderna and sometimes Pfizer when we get it, but we're doing pediatric clinics, as you may have seen, of the 5 to 11-year-olds. And those are the kids we really want to get to the most because they have the lowest vaccination rates at this point. We only have about 7.6% of our children in this county who are vaccinated for COVID-19. It is half the dose of a normal dose. It's very safe and effective. Many parents, pediatricians, healthcare providers, our public health staff who have young children will tell you that their kids are vaccinated. It's very safe, and it's the best thing to do to protect them going through this winter and protecting anyone in your household that may be older or immunocompromised. Our 12 to 17-year-olds are about 45% vaccinated. We want to get that higher as well. All the other age groups and adults are looking fairly well, although we do want to get that all of those age groups to 70, 75 and above. Our vaccination rates for 55 and older are in the 80s, 81%, 87% for 65 and older, and 84% for 75 and older. So we do have a good amount of protection there in our, I say older folks because 55 and older I don't consider older, but as you get up in those categories, our vaccination rates are looking much better. So we're really focusing on our youth. We want to keep schools open. We want to keep kids in school, have as least amount of disruption for parents as possible in terms of quarantine. I will say a little bit. I wanted to update folks on the Omicron variant that we've been hearing about in the news. Right now I want to say that there's a lot we don't know. The World Health Organization, the CDC, and the State Health Department, Wadsworth Laboratory are on alert and looking for this particular variant, which is one of about 30 different variants that have been identified. It is a little bit higher on the list, maybe number 11 of some of the variants, such as, you're familiar with the Delta variant, which was one of the first variants that we discovered shortly after the, about 8 months into the pandemic. And there will continue to be variants because viruses mutate. The thing we want to keep an eye on is how well do our vaccines work in terms of efficacy against the variants and the new viruses as a result of mutation. So that's what the researchers will be following as they identify this. It has been just very recently detected in Canada. It's just a matter of time until it's detected in New York State and even in this county. So there's not a reason for panic. There's a reason for concern in terms of, just watching what it does, how it behaves. Right now, the Omicron variant is very highly transmissible in South Africa, but it doesn't seem to be making people as sick as the original SARS-CoV-2 virus or the Delta variant. So we want to be reassuring in that manner, but also watchful, because this is what public health does in terms of being prepared, watching the research and how this evolves and what we can do to protect you. And what you can do to protect yourself. So, bottom line is it's the same message. Get vaccinated. Get those that you love vaccinated. Wear a mask indoors, especially. Socially distance. And, wash your hands. We can't forget that one. These are the tools that will continue to protect us. Hospitalizations are going back up again as they were before. We're about 9 or 10 in our local hospital. The good news is that there haven't been a whole lot of people on ventilators. That is very good news. However, we want people to stay out of the hospital. We don't want people to get sick in the first place, so sick that they have to go into the hospital for care, because that's very concerning. So vaccination is your best option for preventing serious illness, complications, especially if you have underlying health issues, if you're overweight, if you have diabetes, hypertension, asthma, other health issues that put you at higher risk. Certainly age, 50, 60 and above, put you at slightly higher risk, but we are seeing people who are younger hospitalized. Also, I want to mention that 80% or more of all the hospitalizations from COVID in the last 3 or 4 months have been among slightly younger people in their 40s and 50s and 60s. So at the beginning of this, we saw a lot of people in their 70s, 80s, and 90s. So it is starting to affect people, and the younger age groups, and 70 to 80% of them are not vaccinated. So that is who this virus is impacting the most. So it is very transmissible, and we want to just reinforce the message of, we want people to enjoy their families, their friends, get-togethers, but do it safely by following these recommendations. So the positivity rate in Sullivan County is right now on the 7-day average is about 8.4%. That's pretty high. We want to see that 5% or below, and it's very high compared to surrounding counties. So we want to make sure that we're able to keep things open and continue business as usual. You may want to consider thinking carefully again about social distancing in the workplace and businesses. But certainly some of those recommendations will come from the state if they come, if we need to do anything differently. We're averaging about, as I said before, about 50 new cases per day, and we do anticipate that to increase. The good news is that we continue our vaccination clinics every week at Public Health on Wednesdays. On our website, you can look at the types of booster clinics and when they are. They're generally 1 to 5 or 2 to 6, 2 to 7 pediatric clinics that will be scheduled. There are many pharmacies who are offering vaccinations. There are more pharmacies and pediatricians who are also offering pediatric vaccine. So there's a list on our website, or call your local pharmacy to see, or your healthcare provider to see how soon you can get your children in for a vaccine. So that's the update, and I appreciate the opportunity to provide it to you. We have, through Public Health and our Medical Reserve Corps, as of the beginning of this year, vaccinated over 15,332 county residents, and the clinics continue. We appreciate our partnerships with our healthcare providers and pharmacists. So have a wonderful holiday, and I may be talking to you again soon. Thank you.
Thank you, Nancy.